can physical therapy help with hemorrhoids and those? Okay, tell me more later.
Yeah, absolutely. So to keep it on simple terms, hemorrhoids can be where blood vessels get swollen and sometimes they come out of the rectum. Okay, so you can see them as just like tissue sticking out. The physical therapy can help in a couple ways. So we can help harmonize the pelvic floor muscles so they're not being pulled or tweaked to where they're, instead of having proper position, they're being pushed out. The other thing is, like I talked about, pressure management. So we can help make sure that you're exhaling as you have a bowel movement, or if you're doing exercise, that you're using the pattern of your breath to maximize the position of your pelvic floor. We can do release work. Sometimes a tight pelvic floor or even just a tight rectum can cause those veins to come out, the blood vessels to come down. And once you have hemorrhoids, you really want your bones and your soft tissue released to maximize the potential of those structures going back up and in.
And what does treatment look like? Is it like you guys physical? Is it breathing? Is it both? Like, how does it look like?
Yeah.
What can I expect? It's
Yes.
such a like, I wouldn't say invasive, but like.
Yeah, it feels like a lot.
Yeah.
It feels like a lot. I remember, we talk to our patients about what we're going to do, and we always get consent before we do anything. I'm thinking this, that, and the other. Are you okay with that? And I remember one of my very first patients. I was nervous. I was a newer pelvic floor therapist, so I gave her every detail. And she looks at me with like this flattened face, and she was like, "That's a lot." I was like, "Well, it is, but I'm the one doing it. You can just hang with me, and if they decline it, we can do a lot of other things and get to the pelvic floor the next time." I'm a big fan of keeping things simple. And if any component of what we do feels overwhelming, we can either piecemeal it or we can do that whole part later.
Got it.
Because truly, correcting your neck, your rib cage, your spine, your abdomen will improve hemorrhoids, incontinence, pelvic floor pain. They really are connected to the point where you can feel better before we even touch your pelvic floor.
When I have research on those topics, there's only surgery as the solution. And it feels like, why would you do surgery for
Right.
that in that place? Like, what the fluff?
I know.
Like, what's
Yeah.
going on? So this is not common knowledge. It's not even, Google doesn't even know this.
We're trying to change Google. We're putting those search words every week. I know, yeah. So specifically for hemorrhoid, surgery is really painful. I've only personally seen a handful of patients post-surgery for hemorrhoids. I have heard pretty scary reports of how it feels to go through that. Just like anything else, sometimes surgery is necessary, and we do not poo-poo surgery as a blanketed approach. I mean, sometimes you have to have surgery, and thank God that
There's
is
a
an option. Like, thank you for the surgeons and for the amazing technology we have. They're minimally invasive now. It's really pretty largely agreed upon that surgery should almost never be a first line of defense with the things that we are talking about. So even if you're referring to incontinence and having surgery to handle your incontinence, one common option is a bladder sling.
What is that?
They're essentially putting a sling around the bladder. They're putting a structure to keep that organ up in the pelvic bowl. And so oftentimes, we can mobilize the bladder intravaginally. It's right there. It's a saggy bag. We can, with our finger, slide it and see what position it's in relative to the hip sockets and allow it to come back to midline. Sometimes that harmonizes the pelvic floor muscles by itself. If an organ is not happy, the musculature around it will guard it. It's a natural, you don't even need to think about it. You just will. So we can mobilize the bladder with our fingers, so that's much nicer than surgery. 2, if their theory is that the position of the bladder needs to improve so that their pants can stay dry, we can change the position of our bladder by tilting our pelvis. If we are in a butt-tucked position, which only every pregnant and postpartum woman is, then your pubic bone goes from being a shelf to being a slide.
Oh.
And so if you're commonly just in this curled position, then you're training your bladder
To go down.
to go down. And then if you have poor pressure management, like you cough and all the pressure goes down,
Yeah.
this poor little sack of tissue has no hope.
Yeah.
But if you learn to more often than not have a proper alignment at your pelvis with sitting, standing, walking, then you're encouraging the bladder to stay up. And it has natural support systems in here. And it should be able to be in a better alignment so that when you cough, there's not all this pressure coming down on it.